And then now we're ready to welcome Marlene and Eric from Intercept. They're going to be coming up talking a little bit about Intercept Pharmaceuticals and what they're doing. So thank you. Yes.
Hi, everyone. Thank you for being here. I feel so lucky that they changed our session to after lunch because I was getting worried that everyone was going to be so hungry and not paying attention. But we are now all filled up and are ready for the afternoon sessions. It's been so amazing so far. We are really, really happy to be in this conference. I am with several colleagues from Intercept who are all in the back, and you will meet Eric very soon. So thank you so much for having us over. I want to start with a little background of Intercept. Some of you already have heard of Intercept Pharmaceuticals. Some of you not. Yesterday, I noticed there has been like some patients in here that have been newly diagnosed. Some have been diagnosed for 5 years, some for 10 years. So probably those that don't know about patient advocacy of Intercept, I want to give a little background. So Intercept started 20 years ago in a little apartment in New York City, founded by Mark Brusansky. He's the former CEO of Intercept. At a time, there was no other therapy for PBC, and after 20 years, Intercept delivered in 2016 the first therapy for PBC. And the first therapy for PBC, I will have here our colleague, hepatologist Eric Ness, who's going to be speaking to some of like our pipeline and clinical trials that we have at Intercept.
Thanks, Marlene. My name is Eric Ness, and I lead the OCA, obeticholic acid, in PBC program at Intercept. I've been with Intercept for just a couple of years, actually. And prior to that, I worked as a clinical hepatologist for roughly 20 years. And so, honestly, this has been an amazing weekend for me personally, just to kind of reconnect with patients like this. It's been unbelievably inspiring, actually, again, to start having these kind of conversations that I was able to have for 20 years. And so I thank, first of all, the PBCers for inviting us and having us here. It's been a wonderful, wonderful conference. There's only been one problem, which occurred at about 4:30 a.m. this morning when I was suddenly awoken by a lot of people out in the hallway next to my room down on the first floor. And, they were courteous, but quite noisy. It seemed maybe like they had been out having a good time. And so I was telling my colleague today, who was in the back, when I saw him for breakfast, I said, I was telling him this little anecdote, and he said, probably not the PBCers. And I think he was right. He's right on just about everything, and I think he hit it out of the park on that one as well. So nonetheless, like I mentioned, I practiced hepatology, transplant hepatology for about 20 years. And so I certainly have not been in your shoes, but I've stood next to them for that time. And I also want to say that, we here at Intercept, and I've stood next to the families also. And I see there's a lot of patients here, but I also see a lot of spouses, so I see a lot of family members, relatives, friends. And so I just want to applaud all the support for those people as well who are supporting all of you. And I think that that's a super important point. Because when people have chronic liver disease, it affects everybody, right? It affects the patient, but it also affects this huge circle around that patient. It affects the communities, it affects everybody. So nonetheless, I just want to recognize all of the additional people that are affected, whether they have PBC or not. So with that, I do want to talk a little bit about what our development program is at Intercept. This is I only got 2 slides, so I just like to talk a little bit. But so this is just a table showing some of our studies, okay? So many of you, especially who have been with the organization for a while, are probably familiar with a number of these studies that are on here. The first one at the top is the POISE trial. Maybe some of you were enrolled in that trial. Maybe your hepatologist or gastroenterologist was an investigator in it. That was the trial that really led to obeticholic acid going on the market, okay? Then there's the COBALT trial. That's this outcomes trial. Many of you may also have been enrolled in that. That has just recently finished. We'll actually have some results that are available in the upcoming big liver meeting in a few weeks, so you can see some of that. The 401 study was for subjects who were really quite advanced, like advanced cirrhosis with some complications. It was quite a small study. That is also completed. You heard yesterday from Chris Bolus, Dr. Bolus. He showed, I don't know if you remember at the beginning of his talk, it was a great talk, and I certainly could relate to him. He talked about, the really early patients who are AMA positive but have normal liver biochemistries, and you're sitting there as a provider saying, what should I do with this? And not really sure, but certainly just following. I can certainly relate to that, had a number of those subjects as well. But then all the way to the transplants and so forth. But nonetheless, during his talk, he mentioned one of our recent studies. It's a real-world study, so it wasn't a randomized, placebo-controlled study and so forth that is available on ct.gov. But it was taking our POISE patients, which we followed for up to 6 years, okay, and then compared them with some external controls, so match controls from various real-world data sets. And if you remember from yesterday, it showed that there was an improvement in transplant-free survival, right? So less transplants, less death, and then also what Cynthia was getting at earlier is the complications. When the question, I thought was a great question, what does it mean to be decompensated? Well, all those things that can happen where you get the fluid in the belly, you get the confusion with all the portal hypertension developing. We saw less of those too in this comparison. Now, this is just one study. It's taking like I said, it's taking those patients from POISE and then comparing them to these real-world controls. Just one study. But we're looking at that in other ways too. So this HEROES US study is another real-world study. Those results also will be coming out in a few weeks at the big liver meeting, and we're very excited about that. And then the last 2 studies here we can kind of think of them sort of as one study for today's purposes, but it gets to more of what Dr. Levy was speaking about, and this is looking at OCA, obeticholic acid, plus bezafibrate, and of course urso, and seeing how that combination of therapy does. There was a real-world study, fairly small, about 60 patients, retrospective study that actually looked at this and said if it took folks who were on all 3 of those therapies, okay, and it said, well, from the time you were just on urso, and then when you added OCA and bezafibrate, they looked at then the results, and what they saw was that all the biochemistries, the ALP, and all those kinds of things were quite improved, and additionally, the itch got a lot better too. So we're now studying this in a very formal, randomized, controlled, placebo-controlled manner. And so with that, maybe we can go to the next slide. I don't know. So this is actually that study that I was just referring to. It's called our 214 study. We're looking at obeticholic acid plus bezafibrate. And these are the sites within the U.S. The greens, I think the greens are the ones that are active. So we have 27 active. And then the 11 they're on the launching pad. They're about to be active, okay? And you can see it's an international study as well. We have sites in Canada, Argentina, Turkey, and Italy, and they're all about to be activated as well. Dr. Levy's been instrumental in helping us with this study. She's actually the chair of our steering committee. And we are proud to say she was able to enroll our first patient for this study. And so we're very thankful for that. And so we're very excited about this. And so this is one of our actively enrolling studies for PBC subjects. Just a couple other things before I turn it back to Marlene. You shouldn't have given me the mic. So, we also are very, very cognizant in with the diversity, equity, and inclusion. And so with our fixed dose combination studies, that is an important part of what we're doing. And certainly we're more than happy to speak with anybody about that at our booth afterwards. And also that prior slide that I showed, it's really just the tip of the iceberg of what, well, maybe it's like half the iceberg of what we're doing. But nonetheless, we are doing lots of other real-world studies. We're looking at, what we call outcomes, which is death, transplant, and all these hospitalizations for the complications of liver disease. We're looking at that, but we're also looking at other things. We're looking at, PBC patients are not an ALP, right? I mean, there's so much more to it, right? So beyond ALP, what other biochemistries, what other non-lab things really matter? We're looking at all those things. And so we're actually quite excited about that, and I think you'll be seeing a lot of that coming out over the next 12, 24 months out of Intercept. And so I guess what I would say to summarize is, one, we are very dedicated to you, the PBC community. Two, we're doing a lot. And three, we want to hear from you. And so I think Marlene can speak a little bit more to that. But thank you for your time.
Thank you so much, Eric.
I guess you don't need that.
Yes, I don't need this. Thank you. Thank you, Eric. So as Eric mentioned, we're really committed to the patient community, to patients, to your care team as well. Here you see, I love this slide. It's you see here real patient pictures. Some of them have NASH and some of them have PBC. Shout out to our executive leadership here, Carol Roberts, her picture is over there. Our commitment to patients is not only externally, like how we engage with patient organizations, it's also internally at Intercept. If you go to our offices in Morristown, our headquarters are in Morristown, New Jersey, you will see like our walls line up with patient pictures, which are there to inspire our employees every single day. Because we want to make sure that when our employees come to work, see these pictures, focus on the work that they're doing every day on research, like Eric and like several of our teams back there that are in our team of research and development, and aim to make a difference for the community and try to bring transformative therapies to market, hopefully. How we commit with patient organizations. So there's several ways where how we engage and collaborate with patient advocacy organizations, as well with individual advocates. We support them through awareness, disease events, fundraising, galas, through co-collaborating in educational webinars, educational content, materials for the public. We work with across different liver disease organizations, the Global Liver Institute, PBC Foundation, who I know Robert is here in the audience. We have participated in ALF Liver Walk before the pandemic. In the middle picture you'll see, we had a Facebook event. It was a webinar, an educational webinar with PBC patients and hepatologists. The webinar aimed to educate the community in the Facebook group. And we also had, Eric mentioned a little bit about the healthcare equity initiatives that we have at Intercept. We had a webinar last year in 2021, and that was a US focus only, and then it created more discussion that this year in June 2022, we had a global summit for these healthcare equities initiatives. So this is some examples on how we engage with the community, with patient organizations and advocates. But as Eric mentioned, we want to hear from you. We want to hear your story. Learning from you and from your journey and your disease is how help us to shape research in PBC. So I want to thank you for the opportunity for having us over, and thank you to Kathy and to Carol. We really appreciate our time and your support to Intercept. Thank you so much.